consultant physician and diabetologist. Today we'll discuss about hypertension. Hypertension, is also known as high blood pressure, is a long-term medical condition in which blood pressure in the arteries is persistently elevated. The systolic blood pressure more than or equal to 140 or diastolic blood pressure more than or equal to 90 is considered to be a diagnostic criteria for hypertension. We have types of hypertension include prehypertension, that is systolic BP from 120 to 139 and diastolic BP from 80 to 89. Hypertension stage 1, that is systolic BP from 140 to 159 and diastolic blood pressure from 90 to 99. Hypertension stage 2 includes systolic BP more than or equal to 160 and diastolic BP more than or equal to 100. And pregnancy-induced hypertension because of increased production of hormones and enzymes during pregnancy. Etiology: primary hypertension. It is elevation in BP without any identified cause. Secondary hypertension is elevation of BP with an exact cause. This type is accounted to 5 to 10% of total cases. The more common causes include congenital narrowing of aorta, renal disease, endocrine disorders like Cushing syndrome, neuro disorders like any brain tumor or head injury, or any obstructive sleep apnea syndrome due to obesity, or medications like OCPs, oral contraceptives, or NSAIDs, the painkillers, drugs like drug abuse like cocaine, cirrhosis of liver. Risk factors include age, chance of coronary artery disease after like 50 years of age, alcohol, smoking, and diabetes. Next risk factor, excessive dietary intake of sodium, that is salt. In gender, males are more commonly affected compared to females. Family history, obesity, sedentary lifestyle, and stress. The general lifestyle modification should be performed for treating. Prehypertension is generally addressed by decreasing the dietary salt intake and performing any stress relieving activity. Stress relieving activity will be generally a daily hobbies or this thing. Trying to practice it for at least like 15 to 30 minutes a day, and make sure you are clocking in at least 3.5 hours of walk per day. And other risk factors like obesity, it needs to be assessed. More commonly, hypertension also is associated with insulin resistance, which we are seeing in 50% of the cases. So dietary modification should include a high fiber diet to address that. And say stage 1 hypertension, generally the drug of choice, if the patient's age is less than 45, the drug of choice would be angiotensin receptor blocker, that is telmisartan, like that. And if the age of the patient is more than 45, generally we opt for a calcium channel blocker. Say if the patient is having hypertension with increased heart rate, then choice of drug would be metoprolol. Say in stage 2 hypertension, we generally opt for some combination drugs. That is we combine a beta blocker with an ARB, or we combine an ARB, angiotensin receptor blocker, with a diuretic, like that. And the other profiles needs to be ascertained. Generally, lipids profile is asked, and lipid ratio should be ideally maintained. And if the cholesterol levels are high, patients are generally recommended to take some statin drugs which address the high cholesterol levels. Or if the triglyceride levels are high, then patients are advised to take any phenofibrates and to take any high fiber diets. Okay. Pregnancy induced hypertension generally, more often or not, pregnancy induced hypertension has two entities. One is plain pregnancy induced hypertension without any renal changes. Second is the pregnancy induced hypertension with renal changes. That is maybe the renal changes meaning increased ratio of protein excretion in urine. So that is generally, and also that is called as eclampsia. It also manifests with seizures also. So generally for an eclampsia patient, and if they are requested to advised for any ICU care admissions. For normal this thing, we generally opt for any labetalol preparations. Those are beta blockers, long acting beta blockers, or any calcium channel blockers. Nifedipine is also advised. More often or not, after delivery, almost like 80% of the cases post delivery, they come back to normal. But the risk factor of this thing is those who are diagnosed with pregnancy induced PIH, chances of them uh, uh, being diagnosed as hypertensive in the near coming 3 years are on a higher side compared to a general population.